Okay, our last speaker is another old-time colleague of ours at Cleveland Clinic, Carol Santalucia. She is an MBA in Healthcare Administration, and she's a really seasoned healthcare leader, and she held various service excellence and leadership roles here in the Cleveland Clinic and other places. And she is a past president of the Society for Healthcare Consumer Advocacy. And she's giving a presentation on some very important how to communicate effectively with your physicians. I know it is a very hard thing to do, but Carol.
Good morning. So this talk is going to be a little bit different than the others, much less clinical, obviously, and yet I think a really important topic. And I will say, I bet for this group it's not so difficult. And the reason I say that is that I have been really impressed with those of you who I've spoken with this morning, and really in admiration and awe to you, Ricky and Don, and to all of you for your commitment to do what you are doing. You are owning this, you're taking control, you're networking, you're supporting each other, you're working for a cure as partners with the healthcare team, and I really applaud you for that. I also, for those of you who are not from Cleveland, I welcome you to Cleveland. Sorry about all the rain yesterday, but I think today's going to be a nicer day. As I said, this talk is going to be different. And my whole career, I started at the Cleveland Clinic in 1983. Yeah, I'm pretty old. I've been here doing this a long time and loving it. My role, I started out as a patient advocate, an ombudsman, for many, many years. And as a result of that work and learning the struggles that all of our patients sometimes have, many times with communication issues, I created some programs here at the clinic and have moved into a more proactive position as the Director of Service Excellence and Culture. So what I want to talk to you about today is, first of all, the work that we're doing around communication on our end, on the provider's end. We're working very, very hard at the Cleveland Clinic to make sure that we're creating an environment here that is very much centered around our relationships. Sometimes you'll hear people say it's patient-centered. I like to change that a bit and say it's relationship-centered. Because as this industry, healthcare communication and patient experience in healthcare, as it has grown, it went from being very hospital-centered or even sometimes doctor-centered. The pendulum swung over here to it becoming very patient-centered. And that's a great thing, except that it left out the provider. And oftentimes they would say to me, what about me? And I think the pendulum needs to swing here so that it's relationship-centered and that we care for everyone in this environment, because it's a tough environment. It's tough for patients who are going through a very difficult or trying time, and it's also difficult for the caregiver who is working with the patient, and then it's difficult for the employee who cares so much about making a difference and frequently is frustrated by the lack of progress. So I want to tell you a little bit about the work we're doing on our end. I also want to give you a few bits of advice and some tips on that ever, ever, ever important communication with your provider. And I don't imagine that anything I'm going to say in that regard is going to be shocking or new to you, but I'm hopeful that if there's one bit of advice that you can take away or give to somebody that you know and love, then it will be well worth it. And then finally, I want to spend a little bit of time on the importance of building rapport with your doctor. Because when you have that rapport, your doctor knows you and knows where you're coming from and can really help serve you better. So I think there's a lot of value and great rewards from taking some time and energy and effort to build that rapport. And then finally, even when you do all of that, sometimes things still go wrong and it's not the right fit. And then I'll talk a little bit about some suggestions of what you can do then. So I wanted to start with this quote because this was from one of our founding fathers here at the Cleveland Clinic. And he said this in 1921. And actually, this quote is hanging on the wall in our main entrance of the clinic. So you may have seen it. The patient coming into the hospital should feel the touch of human kindness all through his treatment. And what I love about this is that that was our mantra in 1921, and it still is today. And I'm not saying that we always hit the mark and that we always get it right, because we don't. We work at it, and we keep trying to get better. But the fact that this is still who we are today is something that I'm very, very proud of. And I know you're not all Cleveland Clinic patients. I'm not trying to make that point, but I can tell you, because of the work that I do with my colleagues across the country, that we are all working very hard at this, and therefore there should be people in the areas, in the clinics and hospitals that you go to that are working on this as well. And I'm adding this slide because I think this is really interesting. When we first did a kind of a reset when it came to patient experience, I will tell you that when I started here in 1983, it was not an environment that I could speak those things about. Even though that was our founding mantra, I think we got away from it. And it was actually our CEO, Dr. Toby Cosgrove, was giving a presentation to a group of MBA students, I think a group of Harvard students, if I'm not mistaken. And one brave young woman raised her hand, spoke up, and said, Dr. Cosgrove, I know that your hospital gives great medical care, but I also have heard that you treat people like a number. Do you ever teach empathy in your organization? And he said that he could have been knocked over with a feather. He was shocked by that question. And he came back home and he said to all of us, we are changing that reputation. Now, of course, I'm thinking, I've been saying this to you for a while. But I had to get over that. I had to say, okay, we're there. And I give him so much credit because that has been one of his greatest, in my opinion, legacies here at the clinic, is that he really came back and he said, we're going to change that. So one of the first things we did was, we asked our leaders, what do you think patients want? And, we said productivity, efficiency, competence, expertise, safety, kindness, and compassion. But then we asked our patients. And it was really interesting because look what was first: kindness and compassion. Competence and expertise was there, productivity and efficiency and safety was there. But that kindness and compassion was first. And we did a lot of time actually talking to our patients about what was most important to them. And the clinical expertise, of course, is most important, but that's a given. And so beyond that, people want to be treated with kindness and compassion and empathy. And really, empathy is what I focus on in my job, is helping our providers make that emotional connection with our patients so that you can feel free to get the most out of that encounter, so that you can really have a conversation that is based on trust and respect and dignity. So one of the things that we work very, very hard on is this philosophy around this. And we have a program called Communicate with Heart. And it really is, no pun intended, it comes from the heart. And it's really, our goals are to increase the awareness of every interaction and how important it is. And really to understand that our roles are beyond just our tasks. There's a passion here. There's a mission for who we are and what we do and why we do it. And also to empower our employees to really deliver world-class care. Does that make a difference? Does it make a difference to have that kind of empathy and compassion beyond the clinical expertise? There's been a lot of research done, and what it has shown is that kinder care, better information sharing, compassionate practice, really partnering, does result in many, many improved health outcomes. Faster healing of wounds, reduced pain, reduced anxiety, reduced blood pressure, shorter stays, shorter duration and severity of the common cold even. So I guess what I want to end that part of it is saying that I believe it's not enough to just be excellent clinically. It also is important from our end, from the provider's end, to do what we can to make that relationship a good one. So, some advice and some tips for you on the other end, because I believe it's both of us. We're partners here. This cannot be one-sided. So first of all, come prepared. And again, not knowing you, because I don't really know you yet, but the little bit of communicating that I've done with some of you and what I see about this conference, I bet you do come prepared. Know what the goal is of that visit and state it up front. You know, maybe your goal, maybe you're new in this, and maybe your goal is to find out as much about this disease as you can. Or maybe your goal is to really find out how you can network with others. Or maybe your goal is to get much more information about a treatment you've heard about. State it up front so that your clinician, your provider knows what your goal is about the visit. And then also, in addition to stating what your goal is, listen. Really be in the moment. And this is just a communication technique for all of us. It goes far beyond the patient and provider relationship. But so often when we're listening, we're getting ready with the next thing we're going to say. And we miss so much when we do that. So my advice to all of us, including to our providers, is really be in the moment and listen to what that person is saying. When you do, on both sides of the equation, the relationship and the conversation is so much richer. So listen for understanding, not so that you can get ready to say the next thing. And I even like to say, practice active listening or empathetic listening. Try to understand where the other person's coming from. And then also, at the conclusion of the visit, paraphrase or summarize what you heard. And maybe read it back or state it back. So what I hear you saying is, or what our next steps are, so that you are crystal clear when you leave there and you don't get home and wonder what was that about. And if you do get home and wonder what it was about, check, call back. Oftentimes your provider will have a person, a nurse in the office or somebody that you can really access easily. Take advantage of that. And also take somebody along with you if in the moment you think you're going to forget, which we all do, especially when we're anxious. I know that my mother, who died actually 20 years ago now of ovarian cancer, was a patient here, and I went with her to her visits. I walked the journey with her, and I learned so much. And my mother was a wonderful, kind, intelligent woman who was facing her disease. She had ovarian cancer, and she was facing it with such strength and dignity and courage, and yet she would often leave the visit and say, "What was that he said to me?" You know, it's the anxiety of the moment makes it difficult for us to process it and remember it. So often I would just, afterwards we would talk through it, and sometimes she would stop the physician and say, "Wait a minute, what does that word mean?" I would go, "Yes, Mom, that's awesome." And sometimes afterwards she would ask me, and she always said, "What do people do that don't have a daughter in this field?" And it bothered me when she would ask me that. So I encourage people, whether it's a daughter or a spouse or a sibling or a son, if you can find somebody that can walk the journey with you, it helps a lot. Have your questions written down, because invariably you'll forget to ask something that you really wanted to ask. And then build rapport with your doctor. As I said, to me, this is one of the most important things. I think that I've seen so many examples of great rapport, I know even with me and my own clinicians, and I work at it. I will tell you that I do believe on our end we have to work at it, but I'm also challenging each of you to also own this. Really work hard at it, be intentional about it, maybe even call it out if you need to. You might say something like, you know, Dr. So-and-so, I'm working really hard at building rapport with you, and I'm concerned because, and just state it. And depending on how that person, that physician answers you, you may decide this isn't the physician for you. That might be bold of me to say, but I believe it. Most of the time, I think what you will get, I hope what you will get, is a response that indicates that that physician wasn't aware. Because oftentimes, what we perceive as a lack of good communication is not intentional. And so bringing it out, calling it out, bringing it to their attention in a very appropriate and kind and reasonable way is an entirely okay thing to do. So I really encourage people to do that, and based on that conversation, you're either going to have a really great relationship now with your doctor, or you're going to decide maybe this isn't the right fit. So what if you do all of this and it isn't the right fit? It's not going well. And the first thing I always suggest is that you discuss it. You really just bring it up and call it out and say, I just feel like this relationship is not going well. And again, you might get a response that changes your mind. Another thing you can do is talk to an ombudsman or a patient advocate. Here at the clinic, we call that position ombudsman. I was in that role for many, many years, and I can tell you that there were many times that a patient would come to me, discuss a concern. Again, it was often about communication. We would talk it through. I would bring the provider, the clinician, in on the conversation, and oftentimes we could resolve it, and we could kind of do a reset, and things could get going in the right direction. If that doesn't happen, it's okay to change doctors. Now again, first and foremost, you want the clinical expertise that you're looking for. But I always say, it doesn't have to be an either or. It doesn't have to be a good clinician or a good communicator. I want someone that is both. And I challenge you and encourage you to find someone who is both. So I guess my final thoughts, and in conclusion, I heard, I was meeting with our new residents. In June and July, all of our new residents and fellows start here at the Cleveland Clinic. And, they are overwhelmed, of course, and they're learning so much about the process and the procedures. But what I like to do, I spend a day with them, and we talk about our culture. What is our culture? We have a culture in which we put patients first. We have a culture in which we care for each other as well and support each other in this work. We have a culture where if something doesn't seem right, we speak up about it. So it was really an honor to work for a day with some of my colleagues across the organization to really work with our new residents and fellows to welcome them into this family and into this culture. And somebody showed a slide that had a quote by Winston Churchill, and I just thought it really resonated with what I wanted to talk about today. So I'm going to end with this quote. It's by Winston Churchill, and he says, "Courage is what it takes to stand up and speak. Courage is also what it takes to sit down and listen." And I think that is so pertinent to this discussion. You are all good at this. I can tell because of what you have created here. You are willing to stand up and speak. And maybe you're just finding your voice, but do keep working at that, because that will end in a result that is going to give you a better outcome. And also be sure to be listening at the same time. So I'm going to hold questions because I know we'll do that at the panel discussion, but I just want to end by saying thank you so very much for allowing me the honor of taking a few minutes to address all of you. Thank you.